My name is Don Sim. I am an M1 student, and I was awarded the National Health Service Corps Scholarship. Well, it definitely fit into my goals of me becoming a physician because primary care was something that I was always considered, especially my background in nutrition and public health. And so primary care is really a matter of preventive health services and really being the gatekeeper for the patient. And so in that respect, just my background in general as well as primary care, they seem to fit very well. And so that's why I decided to apply for the scholarship because I knew I was going to go into primary care. So the minimum years of service required is 2 years for that's minimum, and so for every year after that it's an additional year. So if you're receiving the scholarship for 4 years, then it's 4 years of service. Not in any area that they place you, you can actually put preferences. Definitely, I mean NEOMED is definitely primary care oriented, especially with the things that we're going through now with PACE and everything else like that. And they really try to emphasize a physician-patient relationship, which was ironically, or not ironically, coincidentally, part of my research before I came here. And so all of that really plays a role in putting the patient first and being able to communicate with them.
Financially?
Well, I did have a year off before this, and so it gave me a lot of time, and it's a huge relief. I can't tell you how much it lifts the burden, really, because I already have undergraduate debt, and so for me to not think about that for medical school, which can easily go up to $200,000–300,000, it's a lot of money to save, and so it's a huge relief. I am married. I don't have any kids, but I do have a 14 or 12-year-old brother, and so my parents right now, actually, because of health issues, were not doing so well financially, and so I mean, even for them, it's something where they can be really thankful for. They don't have to think about my medical education fees and everything like that, and so they can sort of really focus on my brother. And so I'm just glad that I can help them out that way. I mean, not really. It was definitely primary care. I just didn't know what aspect of primary care because before medical school, we really don't know what's available to you. And not that I'm that far along in my first year, but probably looking into internal medicine because it's a little more in depth depending on what field you go into compared to family medicine and pediatrics. I don't think it's really right for me, so probably gearing towards internal medicine, but we're not really sure until we go through rotation. So okay, all right, so definitely only apply if you're seriously considering primary care because this puts you in a binding contract where you have to go into primary care. So if you're not sure, then you should probably wait because although the scholarship isn't retroactive, you can still pay off whenever you apply. And if you really like interacting with patients firsthand, then it might be the right thing for you.